Hi Andrew, how are you? My name's Kate. I'm the physician assistant student. I'll be taking care of you
Nice to meet you,
today.
Kate. How are you?
Good. So what brought you in today?
Well, for a long amount of time, it's been really difficult for me to breathe.
Okay.
But I'd say over the last week, it's been really tough, which is what brought me in.
Breathing issues. Okay. Excuse me, I'm going to be taking some notes. I just want to make sure I'm as thorough as possible, okay?
Mm-hmm.
So you've been having the breathing issues for 7 days, but it's a long-term thing as well?
Mm-hmm. Yeah, I would probably 2 years constantly.
2 years constantly.
Mm-hmm.
And when you say you have breathing issues, can you describe that? Do you feel like you can't take a breath in? Do you feel like you can't get enough air in?
If I'm walking or running, anything where I exert myself, it's just I can't catch my breath.
Okay, can't catch your breath when you're. And what makes it better? Does anything make it better?
If I just sit down, stop what I'm doing, not talk.
And you said so. This originally started 2 years ago. Have you ever seen a doctor for it at all?
No.
No, this is the first time.
Mm-hmm.
So mostly when you have this issue, you notice it when you're exercising or exerting yourself.
Yeah.
Any other time of the day, it's usually not an issue?
Yeah.
Okay.
I would say so.
Good. And you notice it's been getting worse as of 7 days.
Yeah. I occasionally, over the 2 years, I'll have periods of exaggeration and it gets awful, and this week's just been really bad.
Is it usually during a time of year that it gets bad? Have you noticed with the past 2 years? No time of year, spring or?
Nope.
And have you taken any medications or anything to make it better? Or tried anything?
No, I'm on medicine for my blood pressure. Other than that, nope.
And since the past 7 days, would you say your symptoms have been getting worse? Or has it just, so I know
it just hasn't gotten better.
It just hasn't gotten better. It stayed the same.
Mm-hmm.
And you said that you have high blood pressure.
Mm-hmm.
Do you take medications for it? Do you know what you take?
Yeah, Metoprolol. I think it's 25. Just once,
Do you take it once a day?
Mm-hmm.
And how do you take it?
It's a pill.
Okay. And going back to your symptoms, are you having any chest pain when this happens?
Not really. The only thing that really I've noticed with you having trouble to breathe, I cough up a lot of stuff.
You cough, okay.
Yeah.
And when you cough, what does it look like?
Well, I think it's mucus. It's kind of like white, yellow.
And are you coughing any other time of the day?
Just constantly. And when I am exerting myself or anything like that, then it's worse. In the morning when I wake up, I have to cough out a lot of stuff usually.
And it's worse when you're exerting yourself. Okay, just to start to recap, so you've had shortness of breath in the past 7 days. It's been worse.
Mm-hmm.
It gets worse when you're exerting yourself or running.
Mm-hmm.
It doesn't really get any better. It's not really been noticed to be any around seasonal or certain timings. It's pretty constant.
Mm-hmm.
You're coughing a lot and you bring up some mucus, and that happens more when you wake up in the morning and when you're exerting yourself as well. Have you noticed anything else going on?
No, pretty much that's been it.
I
think those are my two big things, over the last 2 years, like I said, but it's been awful.
Do you have any, and you said no chest pain.
Mm-hmm.
Do you have any other, do you have any nasal congestion?
No.
Any sinus issues?
No.
And does anyone in your family have anything like this?
Well, I know both my parents, I think it's called COPD.
Okay, yeah.
They're smokers, though. I mean, I used to smoke, but...
You did?
Yeah.
When did you stop smoking?
Probably 3 years ago, I think I stopped.
And how many packs a day did you smoke? When did you start smoking?
I smoked for a 10-year-long period. And I think the first half of that, it was a pack a day, and then the second half, it was 2 packs a day, and I knew I had to quit. especially with my parents, you know, what they went through.
Yes. Makes sense. When you, so you smoking, no nasal issues.
Mhm.
Your parents, are they still smoking?
A little bit. They really
Okay.
can't quit it. They're trying to, you know, to reduce it because they're suffering from that condition or whatever,
Mhm.
but they're trying.
And do you have any allergies that you know of?
Yeah, when I was really little, I couldn't eat strawberries. Now I'm fine.
Okay.
And then bee stings. Whenever I get stung by a bee, just, you know, break out in hives.
And the strawberries have resolved though.
Yeah, I think so.
Any allergies to medications?
Nothing enough.
Do you have any seasonal allergies that you know of?
No.
Do you take any other medications besides the metoprolol?
Nope.
No. Any vitamins, herbal substances?
No. No.
Okay. And aside from the cough that we talked about, do you notice anything else with your shortness of breath that you'd like to let me know about?
Well, I feel like it kind of just fits in there. I just get really tired
You
when
get
that
really
happens.
tired.
Yeah. It's really, I hate not being able to breathe, and mucus is really annoying.
Do you have any pain upon breathing?
No.
And scale of 1 to 10, 10 being the worst shortness of breath you've experienced, and 1 being none at all, where would you say this fits in?
The last 2 weeks probably like an 8,
Okay.
8 or 9, and then, you know, it's been constant. You know, maybe like a 4 or 5 before that.
Now I'm going to ask a little bit about your past medical history. Have you ever had any illnesses as a child?
Definitely chickenpox.
You had chickenpox?
Yeah. Other than that, I don't think anything else.
Did you ever have any measles or mumps?
Measles, yes.
You did.
Mumps, no, I don't think so.
And were you ever told that you had scarlet fever or rheumatic fever, polio, or any psychiatric disorders?
No.
Can you tell me about your childhood? What would you
Absolutely.
perceive it as?
It was just me and my parents. We grew up, you know, in the city, and it was, you know, fairly, I feel like, just pleasant and calm. I was in school a lot, played a couple instruments.
What
Nothing crazy.
instruments did you play?
The clarinet
Yeah.
and the flute, actually.
Very cool. I used to
Yeah.
play clarinet.
Oh, very nice.
So overall, would you say that you had a pretty positive childhood?
Yeah, absolutely.
And do you know if you were up to date on your vaccinations as a child?
I gave my vaccination form to the nurse up front.
And any illnesses now? I know you have high blood pressure, but do you have any issues with thyroid or heart disease?
Not that I know of. Heart. I know that my dad has a heart condition.
Okay.
I don't know what it is, but I haven't been diagnosed with anything.
Okay. So your dad does. Do you have any history of asthma?
No.
And have you had a flu vaccine this year?
Yeah.
And are you up to date on your hepatitis vaccinations, all your adult vaccinations as well?
I think they're up front too. I
They're
can
up
tell you
front.
for certain.
Have you ever in the past had any accidents or injuries?
I broke my my wrist. Probably like 10 years ago, I think. Something like that. It was just from snowboarding, but cast, and it was fine. I think that's it.
Any car accidents or anything like that? Have you ever been hospitalized?
Yes, I had to get stitches in my face, actually. I just got cut with a knife, and they just had to give me stitches.
A cut with a knife?
Yeah.
How did that happen?
It was just stupid accident, you know? I think that was...
Were you holding the knife?
Yeah.
Yes,
Yeah.
okay. What hospital was that at?
Methodist.
Methodist? And do you know the approximate date and year?
I think
or month
I
and year?
was like 10 years old, maybe like 03,
Okay.
around there.
Do you know the month at all or anything
No.
like that? Okay. And you not have had any complications with that?
No, it's fine.
Any surgeries of the past?
No, I don't think I've had any.
None?
Mm-mm.
Okay, so you had a pretty good childhood, you said.
Mhm.
You should be up to date on all of your vaccinations,
Mhm.
both adult and child. We can check that up front. You have a history of measles and the chicken pox.
Mhm.
Okay, good. And recently, do you keep up to date with health screenings? Like, have you had any tuberculosis skin tests?
Yeah, I think I had it for a job about 2
Okay.
years ago. I had to get one.
And did that check out
Yeah,
okay?
it was fine.
Have you had any cholesterol screenings, lung screenings?
Actually, no. I have that. I think that's something that I'd be interested in. I haven't been to a doctor, like I said, for my
When was your last doctor's appointment?
probably like 8 years ago.
And then I know your family, your mom and dad have a history of COPD.
Mhm.
Your father has a history of a heart issue, but you don't know what that is?
Yeah, no.
Are your mom and dad still living?
Mm-hmm. I think they're both 65 around there.
Do they have any other medical issues that you know of? Any headaches or seizure disorders?
My mom gets migraines,
No.
but and then I know they're always talking about we have a history of skin cancer
Okay.
and lung cancer.
Who had skin cancer? Do you know?
I think it was my grandfather, my mom's dad, and my mom's mom. And then lung cancer, I think that's on my dad's side.
Are your grandparents still alive?
No, they're dead.
Do you know at what age they passed away for your mom's parents?
Yeah, I think they were actually like 55. Really young.
Both of them?
Mm-hmm.
Did they die because of skin cancer?
They died because of, I just know that it had to do with their lungs and they smoked.
They were also smokers.
Yeah. Something with that, I'm not sure.
And your dad's mom, was she a smoker?
My dad's mom, no.
Did
No.
she have any medical issues?
I think that was the history of, no, she had brain cancer.
She had brain cancer.
Yeah.
So your mom's parents both had skin cancer and died around 55.
Mhm.
Your dad's dad had lung cancer. Do you know when he passed away?
I
did?
think he's 75.
75.
Mm-hmm.
And your dad's mom had brain cancer.
Mm-hmm.
And how old was she?
She was 68.
And did she pass from the brain
Mm-hmm.
cancer? Do you have a family history of hypertension? High blood pressure?
My parents, yeah.
Parents. Both of them?
Mm-hmm.
Any history of coronary artery disease?
Not that I know.
Asthma?
Mm-mm.
Diabetes?
Grandfather.
Grandfather?
Dad's dad.
Dad's dad?
Dad.
Any high cholesterol?
Dad. Immediate father.
Any tuberculosis? Liver disease? Kidney
Nothing I know of.
disease?
Mm-mm.
Arthritis? Any allergies that run in the family?
I think some seasonal, but nothing other than that.
Has anyone ever had a stroke?
Nope.
Many mental illnesses or suicide?
Mm-mm.
How about substance abuse?
Not that I know of.
Not that you know of. And any thyroid disease in your family?
Mm-mm.
Okay. So just to recap for the past few things, your parents, your mom and dad both have COPD along with your mom. Oh no, I'm sorry, just your parents have COPD.
Mm-hmm.
Your dad has high cholesterol and hypertension.
Mm-hmm.
Your mom also has hypertension.
Mm-hmm.
Your maternal grandparents had skin cancer and your
Mhm.
paternal grandparents had lung cancer and brain cancer.
Mhm.
Anything else?
No, that's all I can think of.
And then for you, you just have the history. We already talked about. You already have the history of high blood pressure, and then just this lung issue right
Mhm.
now. So now I'm going to talk to you just a bit about your social history to make sure I have everything and have better understanding.
Okay.
Where were you born?
I was born in Philadelphia.
Philadelphia.
Mm-hmm.
And how many years of school did you complete? Do you have a high school degree?
Mm-hmm. Yeah, and I was in college for a little bit, but didn't finish.
What do you do for a living? Do you work?
Yes, I'm a plumber.
Plumber. Do you live with anyone?
I have one roommate. He's just a friend.
Just a friend.
Mm-hmm.
And are you in a relationship?
Nope.
No relationship. Are you sexually active?
Mm-hmm.
Yes.
Mm-hmm.
Have you had any new partners in the last 6 months?
No.
Do you have a partner right now?
No.
How often do you use condoms?
All the time.
That's good. It's good to use them because they're the only barrier that protect against STIs.
Oh, okay.
Do you have any questions about anything like that?
No.
No?
No, not right now.
Do you have any sources of stress in your life? Like
Definitely
financial,
work.
work?
Yeah, definitely work. Financially, I would say no. Definitely work, and that's kind of why I picked up smoking. And
Okay.
when I get stressed, every once in a while, I might smoke a cigarette, but
Okay.
that works pretty much it.
Is your job just on you, or is your boss on you a lot, or is there just high demand?
Well, I'm my own boss. It's just working with people.
Yeah,
Tough.
I know that can be tough for sure.
Mm-hmm.
Have you ever been in the military?
Mm-hmm.
What do you do for fun? Like, what do you do for you?
Well, I like watching movies. I'm really big movie buff. I cook a lot.
Good.
Other than that, I don't know. I'll take my dog for a walk.
Very good. What is your typical eating habits? Do you have a typical diet you keep to?
I eat out a lot like for dinner, but usually I make my food like my lunch every day, and I don't think I'm that bad, but.
Okay, you try to keep kind of healthy.
Mm-hmm.
Do you follow any diets like vegetarian, keto?
No.
There's tons out there nowadays.
Yeah, no, I don't.
Okay. Do you exercise?
Very rarely. Usually no.
Do you drink any caffeine?
Just coffee throughout the day, in the morning especially.
How many cups of coffee would you say you have a day?
At least one, max 3. It varies.
And how are your sleeping habits? How many hours of sleep would you say you get a night?
They're okay. It's just with, I haven't been able to sleep a lot now with the trouble breathing. Sometimes I wake up and hack up, my mucus is an issue still. So maybe like 5.
Have you noticed that when you're sleeping, you are waking up gasping for air or anything?
Mm-hmm.
You are?
Yeah.
Okay, that's important for sure. How do you sleep? On your side, on your back?
On my back. 5 minutes.
And then do you use it? How much alcohol do you drink a week?
I would say like just be eating at night 6 days a week probably.
And how much do you drink?
I drink a lot of beer,
You drink
but
beer.
I don't know. Usually never more than 4. And
Cans?
yeah.
Okay. And does anyone in your life disrespect or harm you?
No.
Do you feel safe both in the home and outside the home?
Mm-hmm.
Okay, so this last part is going to seem like a lot of questions.
Okay.
But just kind of helps me get a thorough history so that we can make sure we didn't miss anything, okay?
Absolutely.
What is your usual weight?
I'd say like around 160.
And have you noticed any changes?
Mm-mm.
No? Have you noticed that your clothes are fitting tighter or looser?
No, the same.
Notice any weakness?
Yeah. When I get tired, absolutely.
And you said you've been tired and
Mhm.
fatigued.
Mm-hmm.
Notice any fevers?
No. Mm-mm.
Any rashes or lumps on your skin?
Mm-mm.
Any sores?
No.
Any itchy or dryness?
Mm-mm.
Any change in the color of your skin?
Sometimes when I get really tired and I'm like dying coughing, I'll get really pale.
Really pale?
Yeah, that scares me.
That is scary. Have you noticed any blueness on your fingertips or anything like that?
Not that I've noticed, no.
Okay. Any change in your hair or nails?
My nails are kind of brittle.
Brittle.
I don't know if that's from the smoking or, but my hair, no, I think my hair's fine.
And any new moles that you've seen?
Mm-mm.
Any change in size or color of normal ones?
Mm-mm.
Have you been experiencing any headaches or head injuries?
No.
Any dizziness or lightheadedness?
When I have my coughing fits, yeah. The dizziness, for sure.
Any vision changes? Any glasses or contacts? Do you wear any?
No.
When was your last eye exam?
I couldn't tell you.
Any pain or redness in your eyes?
No.
Excessive tearing?
No, or coughing when I cough, but
When you
other than
cough.
that, no.
Any double vision or blurred vision? Spots or specks?
Mm-mm.
Flashing lights?
Mm-mm.
Have you ever been told you have glaucoma or cataracts?
No.
And for hearing, do you have any hearing issues?
Mm-mm.
Any ringing in your ear or tinnitus?
Mm-mm.
Earaches or infections?
Mm-mm.
You notice
No.
any discharge?
No.
Good. And do you use any hearing aids?
No.
Any frequent colds or nose stuffiness?
Not that I know of, no.
Discharge or itchiness of your nose?
Mm-mm.
Hay fever?
No, I don't know what that is.
Are
So I think no.
Okay. Any nosebleeds
No.
or sinus problems?
No.
Any conditions that you know of your teeth or gums?
No, but I need to go to the dentist for that, probably.
Okay. Do you wear any dentures?
No.
When was your last dental exam?
I couldn't tell you.
Do you have a sore tongue?
No.
Ever experienced dry mouth?
No.
Sore throat?
Occasionally, I think that, like at night when I'm just coughing a lot.
Coughing. And any hoarseness in your voice?
Yeah, the smoking, for sure.
Have you noticed any swollen glands on your neck?
Mm-mm.
Any like large enlargement? It's called a goiter, like an enlargement of your thyroid gland.
No, I really don't check that.
And you've never been told that though.
Mm-mm.
Any lumps or pain or stiffness of your neck?
No.
And you have been coughing. We know that, and it's productive.
Mm-hmm.
Good. Have you ever had? Do you have any heart issues? Like you do have high blood pressure,
Mm-hmm.
fever. Ever been told you have a heart murmur?
No.
Any palpitations?
Mm-hmm. What's that?
Like, do you feel like a flutter in your chest ever?
No.
How many pillows do you use at night to do you have to use any to help ease your breath?
Sometimes I'll try and take like maybe Advil or some Tylenol, something like that, but usually no.
Do you use any pillows to prop yourself up ever?
Sometimes when it gets really bad.
Do you have any swelling in your hands, ankles, or feet?
No.
And then have you had any EKG results or anything that have been abnormal that
No.
you know of? Do you have any trouble swallowing?
No.
Heartburn?
Mm-mm.
Nausea or bowel movement issues? Any change in your stool color or size?
No.
Change in your bowel habits?
No.
Any pain with defecation?
Mm-mm.
Have you noticed any bleeding or black tarry stools?
Mm-mm.
Any hemorrhoids?
Mm-mm.
Issues with constipation or diarrhea?
No.
Any abdominal pain?
No.
Food intolerance?
Mm-mm.
Excessive belching or passing gas?
Mm-mm.
Any, do you notice that your skin is ever yellow?
Yellow? No.
And do you have any liver or gallbladder issues?
I don't think so.
Any history of hepatitis?
Mm-mm.
Good. Do you get any leg pain when you're exerting yourself? That comes and goes?
I don't think so. I just know I get really weak.
Have you ever been told you have varicose veins?
No.
Any swelling in your legs or feet?
Mm-mm.
Color change in those, we talked about that. Any swelling, redness, or tenderness in your legs or anything?